Yeah.
And so he just kept walking through it. And I was like, hey, I got this device. You're going to get on it twice a week for free. And let's just, and 3 weeks later, they're not suicidal. They're much less depressed. They're on the right path. They've got momentum.
What is going on, everyone? Welcome back. My name is Dr. Phil Sarpon. I'm a psychologist, and this channel is dedicated to all things psychology, wellness, and graduate school. Today, I'm excited to introduce Dr. Clint Carter. He is a medical doctor, a physician, and he's on a mission to change how healthcare works in East Texas. He has over a decade of experience in emergency care, emergency medicine, caring for patients in high-pressure situations when every single second counts. Part of the reason that I love talking with physicians and medical providers about this is because we need healthcare to change. The healthcare model that we have right now in America and Western society is not sustainable. Healthcare insurance is incredibly expensive, too expensive for a number of patients on a yearly basis. If you haven't already, please subscribe to the channel. You can join and become a member and get access to videos that we have not released yet to the public. And so without further ado, we will just jump right into this interview. It's good to see you. I'm super excited for this interview. It's definitely been something I've been looking forward to, and talking with other medical providers, you know, they throw around some of the terminology when it comes to the healthcare realm, things like functional medicine, integrative medicine, holistic medicine. I'm excited to really talk about your practice, but for the audience, could you just tell me a little bit about maybe where you fit within those categories for your practice?
For sure, man. Well, I mean, technically my practice is a direct primary care practice. So that's less of a description of how I practice medicine than it really is a description about the business model of medicine that we're in. So what that means is we don't take insurance, and we bill a monthly or annual membership fee for an individual or a family or even a small business, depending on how they want us to handle it. And then after that, you get all of our attention, hour-long visits, no wait, no waiting room, 24/7 access to one of us, one of our providers. And what we have found is that once you get insurance out of the way, well, then all of a sudden it's a whole new world. Like, you know, when I started this thing, I just did family medicine in the box, residency trained stuff. And it was good, but I was hitting walls. I was like, man, why can't I fix this person or that person, or what's the problem? And then my eyes were gradually open to things more outside the insurance box, like functional medicine, integrative medicine. So we started down the hormone path, which bioidentical hormones are certainly a part of an integrative functional approach to longevity and health. But what it did for me was that I like to say that hormone door opened me into a room full of doors that I didn't know existed. So we have a functionally trained provider here, but he hasn't been functional technically for long, but we've been doing, you know, semi-functional stuff, one patient, one new test, one, you know, gut zoomer at a time. Just meeting the patients where they're at. We have some patients who aren't interested in that, and that's fine. We have some patients who aren't interested in anything that was ever sort of made by a pharmaceutical company, and we're willing to dance with them as well.
Oh, I love that. I think I hear that in a lot of providers too. Like, once you get insurance out of the way, the flood doors open, and there's just so much possibility. And I think medicine becomes very personalized to the individual in terms of what they need, and not what insurance is willing to reimburse for, reject, and claims and things like that. And so I'm sure it gives you, as the provider, just the freedom to really work with your patients on a personal basis. How did the idea come up for you? Because again, this isn't like a common thing for a lot of medical providers to go down that route. For you, how did the idea start?
Well, you know, if you get out of the way we're trained in medical school or nurse practitioner school or PA school and that kind of thing. The assumption is that you're just going to go work for the system. You're going to work for a hospital or a large clinic, and you're just going to take care of patients, which is fine, except that system it only gets paid for certain things. So it naturally, rightfully, points people in the direction of things that get reimbursed, right? So that your tool belt is so small, as it turns out. And then it's all based on evidence-based medicine, which I love, except that, a lot of evidence-based medicine are these giant randomized controlled trials that give data, but they sort of suck all the individuality out of medicine and just assume that the patient in front of you is somehow an average of those 10,000 people out there that were in that randomized control trial.
Right.
And so that's how you have to treat that person. And what we found was I did family medicine residency. I got out, I interviewed at some clinics, hospital-based clinics and different brands of hospital-based clinics. And I was like, no. I walk in the front door. The patients are miserable in the waiting room. The people at the front desk are miserable at the front desk. I walk to the back. The doctors and nurses are pretending not to be miserable because they want me to come help them out. And I was like, I can't live. I'm going to spend more time here than I'm going to spend with my family. I don't want to work in that environment. So we did so much ER in my residency program. I was like, screw it. I'm just going to go to the ER. Off on a random Tuesday. More excitement. I don't have to manage a staff. I just show up. And so that worked for a while. It was fun until it wasn't. And then I realized, man, all I'm doing in the ER is primary care anyway. All these people aren't having emergencies. I mean, you get your emergencies mixed in, but for the most part, everybody just needed access to a doctor and their doctor couldn't see them. So they went to the ER. And I'm doing mostly primary care and urgencies, which should be handled by their primary care. And then when a real emergency came in, I was like, oh, I don't have time for this real emergency. I've got all these other patients I'm carrying. So I just kind of burned out in the whole thing. I just like, you know what? I don't want to be an ER doctor. I came home, told my wife, I was like, is it a job if it steals your soul every shift? Like, this just isn't fulfilling. I'm trading my life for time and money. And it's just, I'm not making a difference like I want. So I was going to quit medicine altogether. I was like, I don't want to be a clinic doctor and I don't want to be an ER doctor.
Wow.
I guess I don't want to be a doctor anymore. At the time, there was a show called Treehouse Masters on TV. And that guy was building tree houses for $200,000 plus a pop. And they're awesome. And he looked like he was having a blast. I was like, I'm going to go build a treehouse company. It's going to be a blast. And my wife and God were like, you are a doctor. So this, and quite frankly, an email came into my ER work email about a concierge conference in California. So we went and one door opened after another. And the next thing you know, Stephanie, my wife's a PA. So together we both worked full-time jobs and then started a membership-based practice with no members. Wow. And 10 years later, we're here with, 6 providers and 3,000 patients and sort of, wow. With the mission to spread the gospel of this personalized, direct primary care. And it's really fun.
Oh my goodness. It's an amazing origin story. And what you mentioned about, would you do something that steals your soul away?
Right.
It's deep because I think I also see that in a lot of medical providers and even in my time working in hospitals, and the burnout for both mental and medical providers is high. Yeah. And it's like you go into med school and you're just so passionate and energetic and just full of life. And then you leave with the life just being sucked out of you. Yeah. It's just so unfortunate. And so it's amazing how you all have been able to build this practice. So I'm curious, when it comes to all of the things that you offer, there's the direct primary care, but also you mentioned either working with hormones, and there's IV therapy and peptide therapy. How are those things maybe different than your traditional medicine in terms of what you all are adding?
So functional medicine at its base is root cause, root-based medicine, right? So what is the root of the problem? Whereas the insurance world finds that really hard to reimburse for. And that's really been the hiccup. It's really easy to see a tree with bad fruit on it and say, okay, how do we fix the fruit? And you go about addressing the fruit. And it's, you're controlling the disease, but you're not really fixing anything. And so root cause is really like, oh, you know what, if we fix the root, we fix the water and all the stuff going into the tree. If we fix the root problem, the fruit will flourish. Yeah. And while that's a gross generalization, but in a way, it's kind of a 180-degree switch on how I look at a patient at the same time. I still use modern medicine tools that I learned in residency, but I really prefer that to be either a temporary Band-Aid or an adjunct, sort of like we've taken you as far as we can at the root, and at some point we do need to fix the fruit for quality of life and longevity reasons. But at the same time, you get people to understand what eating right means and what exercise means and we spend an hour at a time with our patients. So we're looking at their actual lifestyle, their actual budget, their actual, are you a trucker? Are you a long haul trucker? Well, you're not cooking meals at home every night. That's just not how that's going to work. We're talking mental health, spiritual health. And so we get to the root of the problem. And what's fun is so often part of the root of the problem is that, their hormones are all out of whack, or part of their gut is all inflamed and it's causing other inflammation. They're not making serotonin and all these other things. You've got your metabolic issues. Mental health is a huge part of what we do, because when you sit with someone for an hour at a time, you get way past how are you doing? Fine. Right. Yeah. Next thing you know, we got the tissues out. They're like, well, I'm fine. And what else is going on? Well, this and this and this. And I'm like, wow, that sounds really hard. And I'm like, yeah, it's really hard. And then we move on past, and we really get into it. And part of it is that they're not sleeping. And part of it is that life is really hard. And part of it is their joints all hurt and they're all inflamed and they're overweight and they don't know what to do about it. And so we're able to sort of add peptides, add hormones, lifestyle modification, and just meet the patient where they're at and gradually move towards feeling better and being healthy now and later.
Yeah. I think what's valuable about that is that this is sort of like you said, lifestyle medicine, or lifestyle change.
Yeah.
This isn't just what they're doing. This is like kind of who they're becoming and what they're being about, and finding that root cause, and then being able to work in a way that really embodies physical, mental, and spiritual health all together. I don't know, even for myself, and I've seen it with my mental health patients, most of their medical providers may spend 15, 20 minutes with them. And then oftentimes if that person starts crying, they don't even know what to do.
Right.
Right. They're kind of like, they're
so loft.
And so for me to be able to hear that, I just think is incredible. So I'm curious, from a mental health perspective.
Yeah.
When your patients are bringing in stress, anxiety, depression, what are some of the modalities or interventions that you and your team are using?
Well, unfortunately, I'm not a licensed professional counselor, but it feels like it a lot of the time. So I tell my patients, like, listen, I'm a really crappy counselor. I talk too much. I don't know what I'm doing. I'm here for you. But what I try to do is number one, I empathize. Yeah. And I'm like, no, what you're going through, because, classically they'll come in and they'll be going through all this. I'm like, but some people have it so much worse. And, and then I'm like, no. We're not comparing suffering. Everybody suffers and everybody's suffering is real. So that you can let that go. And so now let's just talk about what you just said means in the context of your whole world, your family, your spiritual health, all your physical health. People with chronic pain are like, yeah, but I'm like, no. You're going to be depressed because you hurt all the time. So of course and then depression makes your pain worse. So forgive yourself for that. It's okay, because we're in the Bible Belt. We're Southern Bible Belt. Everyone around here is like, I should be stronger. I'm like, shut up. Give yourself some credit, man. Like, life is hard. It's a fallen world, So we do a lot of, we do have medications. I'm not afraid of doing an SSRI or an SNRI when it calls for it, especially initially if it's needed. We have all of the medication, psychiatrist tricks, plus trying to make them feel better physically, and how that, can I break the pain depression cycle at pain, or can I break that cycle at depression, or can I do both and eventually wean off of one or the other? And then we also have we have tools. Our newest, funnest tool is a transcranial magnetic stimulation device called ExoMind by BTL, and it's a nice next generation of transcranial magnetic stimulation. It's just a magnet that goes over that left prefrontal cortex, where your body does its stressing and its thinking and its computing, and it's what can't turn off when you're trying to go to sleep, and it's where a lot of that anxiety and OCD and ADD and all of that lives, and so it's for 20 years plus, it's been FDA approved for depression and OCD and migraines, actually. But we find that it's amazingly useful in sleep and anxiety and binge eating, and so a lot of other quality of life issues. And it's just a tool. But for the right patient selection, we've had it. We've only really had it up and running since maybe 4 months now. And the first people we used on it were like, all right, listen, we just got trained on it. I'm not going to charge you, but you're suicidal and you refuse to go to an inpatient, because we walk so close with them. I'm like, hey, you're putting me in a bad spot here. You're suicidal and you won't go inpatient. What if something happens to you? What do I'm supposed to call the cops? What am I supposed to do for you? And so we just kept walking through it. And I was like, hey, I got this device. You're going to get on it twice a week for free. And let's just and 2-3 weeks later, they're not suicidal. They're much less depressed. They're on the right path. They've got momentum. Wow. I mean, momentum is so precious. And so, it's 6 sessions, and then you can do a few more if you need, or every so often give yourself a bump. I'm using it to get off my antidepressant, but there are other tools. I've got a colleague down the street who's a psychologist who has neurofeedback and alpha chambers and a lot of other non-medication strategies for mental health. And I'm just like, listen, guys, the world, it's a great time to be alive. It's a really hard time to be alive. You're available 24/7 on your phone, and everyone has all these issues, and Facebook makes it look like everybody's life is perfect but yours, and all the things. Right. But it's also a great time because there's a lot of cool tools out there that are available to help with your body. Just wasn't designed to go through what you're going through. We were designed to find a little food, have some kids, survive, do it again the next day. And we're just hit with so much stuff that we're easily overwhelmed. We're sympathetic overload. And we just got to find ways to switch, meditation, prayer, all the things, stress maintenance tactics. As simple as breathing, all exercise, all the things. And let's bring that sympathetic down and get a little parasympathetic in your life. The part of your nervous system that goes, when the sunset looks pretty, let's get a little more of that. But, it's patient by patient, what fits where they are at that time.
There's a number of things that you mentioned that I want to highlight. One of them was you mentioned empathy, right? And I think that's huge. There was a part of my training where I did a clinical rotation in a big academic and medical institution. And our job was to kind of help the residents, the medical residents at the time, just with simple, small skills that they could just use right away with their patients. And one of them was actually empathy and
Yeah.
just, asking questions, and just, even if you don't know the answer to someone's suffering, just being able to sit with them in their suffering.
Right.
Oftentimes people are so uncomfortable with suffering that they just try and avoid it or move away from it or change the conversation.
Yeah.
And when we helped some of these residents, we just helped them to be more comfortable with sitting in that discomfort. And they saw kind of almost this instant change with a lot of their patients. Their patients started to adhere a little bit more to medication, started to listen more, started to just, and the conversations were better. It was more quality conversations. So just so simple how you could just implement a little bit of empathy, a little bit of some question and answer, and get a whole different result from a patient.
If the patient feels heard,
Yes,
and they feel understood. I mean, part of my story and that burnout story is deep depression. I mean, when I burned out in the ER, I was a hot mess. And my wife was like, nah, we got to get you fixed. And as it turns out, paying money to quit your job, paying another ER to get to work there, and starting a membership practice with 0 patients isn't much of a solution to being overworked and depressed, right? So I went, finally got some hormones, finally got my antidepressant going, been on and off it over the years, and off it usually ends bad long term, but now I've got Exomon, and that's hopefully going to change the game. But the point being here is I can empathize with depression and anxiety straight up. Like I just like, listen, dude, yes, me too. I get it. And just, you spend that much time with someone, you get to know them. You're like, gosh, that must be really hard. Your kid's going through this as well, right? And your husband's going through this as well, right? And we're able to meet them where they're at. But you're right. Once that gets so much more buy-in on whatever the plan is. And the plan, I always tell my patients, I'm the co-pilot, you're the pilot.
Yes.
I'm not going to prescribe you something you don't want. Let me help guide you. Here's some options. What do you think? And then, of course, they're going to be 10 times more compliant. It was their idea. And if it's not working, they know how to get a hold of me instantly to tell me about it. And let's take the next step.
That's also been a paradigm shift that I've realized, in that a lot of patients are so used to going to the medical doctor. Medical doctor tells them what to do, and then they just do it. But it's so passive and transactional in that type of dynamic. And I've had a lot of patients where I'm like, no, advocate for yourself, right?
Yeah.
Do your own research, do your own homework, read your own books, ask questions. But at the end of the day, you're collaborating with your provider on what's going to be best for you. And the patient that goes through the active participation, I feel like the more they put in, the more they get out of it. But it's a paradigm shift because a lot of patients aren't used to that type of dynamic.
Well, and it's a bad vibe, right? It's a meme, right? To come in with your Google searched solutions to your symptoms. And 9 times out of 10, if you just keep asking, Google will eventually tell you that you have cancer. And it's just this whole, what do I do? But if I don't Google it before I go, I'm not going to have time to be heard and get solutions that I'm like philosophically aligned with. Right? I got some patients with wicked high cholesterol, and they're like, listen, anything but a statin. I know I've heard too many bad things about statins. I'm philosophically opposed. I'm like, but your cholesterol is like 1 million. Wow. So, and your dad had a heart attack at age 51. Like, what are we going to do then? Like, let's talk about the options. You're 50 pounds overweight, you're fairly sedentary lifestyle, and you eat a lot of processed carbs all the time. That's a heck of a place to start. Let's do that, or what else? Recently someone was asking me on a different, on my podcast, actually, my nurse was like, we did a Christmas episode, and we were like, naughty or nice. And she was like, patients Googling their problems before they come in. I was like, oh, that's nice. I love it. I love it, because that takes the work. Now I know what they're thinking, because they Googled it anyway. They might as well bring it and talk to me about it. And I have time. That other 10-minute visit, that same doctor who still cares, but he's stuck in a system where he or she only has 10 minutes with that patient, they really don't have time. They just want to tell the patient what they know and think and have the patient do it, because if that happens and the patient were to be compliant, there might be a chance. But that's not necessarily philosophically where the patient's at or what they want to do. And then they don't feel heard, and then they don't do it. And they come back 3 months, 6 months, a year later, and they haven't done any of it. And they're surprised to find out that they look and feel just as bad as they did a year before.
Right. Yeah. And I feel like what ends up happening, there's just sort of Band-Aid solutions to like really significant core ruptures in their health. And I appreciate like in your model that it's not an either or, like you're combining this sense of traditional medications, having those conversations, but also adding in that additional layer of treatment and intervention that is personalized. And one of the questions I wanted to ask you was, for you, have you, like when I think about everything that you're doing as relates to things like exercise, sleep, nutrition, the mental care, the physical care, I guess, how does it all kind of come together? I'm trying to think in my mind what it's like to journey with a patient as it relates to all of those core tenets.
Change is hard. So, if I get the housewife that's working out 5 times a week and killing herself, and she looks pretty good, but she feels like death inside, and well, that's different. Like she might need to work out less, not more. She might and she thinks she's eating right, but what does that even mean? And so, or I get the 100-pound overweight, we'll just stick with mom. We'll stick with the 100-pound overweight mom who hasn't given herself any care, because she's just 100% family. I got to take care of my deadbeat husband, and who won't take care of himself. I got to take care of my kids and all these things. And I was like, okay, well, what about you? You feel you're not sleeping. You feel like death. You're just eating to survive. All those things. And so first, if I want to get to, New York from here, the first place the first thing the question the app is going to ask me is, where are you? Right. And then it's going to be like, all right, where do you want to go? And so you got to meet the patient where they're at and figure out what they've already tried, what's worked for them in the past, what hasn't worked for them in the past. And then we have an hour, but that's only an hour at a time. And we can do that as often as they need. But we do touch on the multiple choice test for them. The multiple choice options are, okay, how about movement? Where are you on the movement process? Tell me about your lifestyle as far as diet goes. And, are y'all cooking at home? Are you on the fly eating out? Are you an on the road truck driver? Where are you? And what are some of the pros and cons of life that way? And then how can we move you slightly towards better? Let's define what healthy diets looks like for you, where the pitfalls are, insulin resistance, I can get into the science a little. I can kind of just make sure that they understand the problem better.
Yeah.
Because if they understand the problem better, then we can move the next step. So yes, it is. All right, well, tell me about your sleep. So I'm not sleeping, but I'm so I just sit there in bed on my phone playing games till 2 a.m. I'm like, well, you're not going to get good sleep doing that. So let's work on what else can we do before bedtime and in bed, and what is the process? And, we have medicines to knock people out as well, but also, you don't have an Ambien deficiency. How can we help you get there? And ultimately we choose a few doable things. Nice. And then we circle back. The decision loop can't be 12 months. We have to circle back. I can check on them on the app, on our communication app in a few weeks. We can have a follow-up in a month or 2 or 3. We can just give it, wherever they're at, and how big a change we're looking for. Do we want to give it time for the labs to change? Do we just need a phone check-in to see how the lifestyle modifications going? It's a very personalized approach, and you do just take people one step at a time in a lot of the categories. And sometimes they're like, I can just do one thing. Like, okay, give me a 30 to 45-minute walk 3 times a week. You can still eat. You can still eat honey buns all day. Let's one thing at a time. We'll get you there. You know? Yeah.
So to me, this model is like just supreme in terms of quality, in terms of care, personalized care. I'm curious how you were able to grow this model from 0 members to where you are today. Was it word of mouth, referrals? Like, how did you expand this model?
Well, so our initial marketing budget was $0, right? And it was just, our whole strategy was happy patients. And if you think of it, the way I used to describe this is like, okay, if your uncle was a doctor, how would you handle that? Okay, so he's available to you 24 hours a day. You have his cell phone. But if you wake up with a sore throat in the middle of the night, you're probably not going to wake him up at 1 a.m. You're going to be like, dude, I got to call Uncle Dan in the morning. This sucks, right? Yeah. So being on call 24/7 turned out to be easy because people naturally, a few people need education, but for the most part, you know, you need a refill on your blood pressure medicine. Do not call me at 1 a.m. I will take care of that the next day. And they get that. People get that. So the negative side to this business model is this 24/7 always on thing. That turned out not to be a problem. And then it was just, you know, I didn't have an office at first. So I'm meeting people at Starbucks, or I'm meeting people at Einstein Bagel, or, you know, and eventually this guy had like this big, you know, skin cancer on his shoulder. He's like, hey, what do you think about this spot? And I was like, oh, no, that's not okay. So then I called the rep who was going to be the one to bring the supplies to my office when I had an office. It's like, okay, I need this, and this. I took him to my kitchen counter at my house. Wow. Biopsied that thing, got it out of there, you know, stuff like that. But eventually we had an office, and me and Stephanie and a nurse, and we're still working full time and doing this. And then it grew organically because this is how people want to be taken care of. Yeah. And back then it was all in the box insurance tricks, and it was still amazing. Wow. And it wasn't until, and then it was 2 years into the practice before I had enough patients that my MD Select paid its own payroll. So I was just working at the ER and dumping money into payroll for my nurse and, you know, the team as it grew, and my own, you know, it covered payroll, not my payroll, everybody else's payroll. And then it took time from there before it was really autonomous, but it grew organically because it was the right thing to do. But here we are, we're 10 years later. 10 years is eternity when it comes to that kind of thing. So now we have 3,000 patients, but some of that growth is that I was taking care of business owners who were like, man, you saved me a lot of money and you take really good care of me. Could you do that for my people, my business, my employees? And the answer is yes. It's easy. I'll give you the Walmart discount, and you just pay me one time for your employees a month, and then they're full members, man. Let's go. Everything is at my cost. Once, if the patient calls me, if my patient cuts their finger cooking dinner, they call me at 7 o'clock at night. I meet them at the office. I sew them up, and I get them back home before dinner's cold, and they've spent $45 because that's what it cost me in supplies to get their finger sewed up. So once you're a member, everything's at my cost. You've covered my overhead. You've covered, in theory, you covered our payroll, right? Once the numbers added up. And then we save the member so much money in the long run. They don't go to the ER. They don't go to the urgent care. They're not on a ton of meds. They feel better. They have the motivation to get up and do things. So in the long run, most people save money because healthcare costs in the system are so inflated that it's low-hanging fruit for them to come, for me to save them cash. I can get a cash-priced X-ray. I can get a cash-priced MRI. I can limit how often they have to go to the orthopedic specialist. I'll do your knee injections. I'll work with you on all that because it's not, by the time I refer to a specialist, the specialists love it because they get to just be special. Yes. Most of the time, they have to do a visit or two of primary care level of workup before they get to go actually do their specialty. And on our patients, not only are they pre-worked up, but we're going to be checking with them afterwards and make sure that, how'd it go? What do you think? I need a copy of your note, and what's the plan? And, Susie's got this going on in the next month. So what about this? And so it's a fun, it's the growth of the thing. And now we have a little marketing in place because our location needs to get bigger, but because we feel led to be able to put a location of like this near you, right? Near other folks, and sort of spread the gospel, if you will, of people getting taken care of the right way. The limitation of the business model might be that I can only see 300 to 500 patients this way. Well, and your average doc has 3,000 patients in a regular clinic.
Yeah.
So if every doctor in the world suddenly became a direct primary care doctor, there'd be a huge shortage. However, a bunch of healthier people out there. And so it's a solution to the problem. Other solutions come along. There's non-membership based functional medicine out there that you just kind of do along with your regular primary care. But we pride ourselves in kind of being a combo solution that doctors, providers, nurses, front desk, and patients all enjoy getting to be a part of.
That's incredible. That is incredible. So one of the things I was thinking about is, for maybe the next generation of providers, you have medical doctors, you have either psychologists, mental health specialists, nurse practitioners, PAs. What advice would you give them? Maybe they're just starting out college and they're just thinking about just different models, different ways to do healthcare. What advice would you give maybe the next generation of upcoming clinicians?
I mean, we joke, I've got friends whose kids are going, the plan is to go to med school. And so I've got doctor friends whose kids are going to med school. And I'm like, you couldn't talk them out of it? Like you didn't tell them what's going on? But the fun part is that people don't go, people go into medicine, they go into healthcare, they want to be a psychologist, they want to be a counselor, they want to be a physical therapist. They want to help people. Yeah. And they want to help people in the way that also gives them that job satisfaction, right? Some people really want to dig in on the mental health side because they see the pain. Some people really want to dig in on the physical therapy side because they've been there and done that or whatever. And so it's still helping people plus your personality. I apparently want to be a know-it-all. And so I went to medical school and now I'm the doctor. And what's funny is all the time my patients are like, well, I want to hear what Dr. Carter has to say about it. I'm like, well, that nurse practitioner you were just talking to is way better at what you're talking about than I am. So don't get lost in the letters behind your name. But what I would say is just don't settle. So the school you're going to, if you get into a professional school, the school that you're going to is going to assume some things. They're going to assume that you're going to work for a big hospital system, that you're going to bill insurance, and that that is as good as you could hope for your patient's outcomes and your quality of life. And hopefully you get paid well enough to justify it all, right? Like, I got paid great as an ER doctor. The money wasn't the problem. It was everything else. So what people need to know is there are other ways to take care of people. There are other business models that exist. And I tell people all the time, like, what I'm doing is what most doctors would do if they were given this business model to work in from the start. So one of the reasons I want to grow what I'm doing is so that other providers who aren't ready to run their own small business, because that's hard and we have zero training. And I mean, I knew nothing about that when I started my company. I was just like, listen, it can't suck worse than what I'm doing right now. And if it goes out of business, I'm going to build tree houses. So who cares? Let's go. And then along the way, I learned some things and God took care of us. And then, since then I've kind of become a business owner. But for folks, there are other ways to don't settle, don't compromise, take care of people the way that makes sense, that how, and learn everything they have to teach you, and know that they don't know everything.
Dr. Carter, so many good nuggets of wisdom. I have one more question, because I think your transparency in terms of your own journey, whether involving the burnout, your mental health journey, how you give to your patients, how you give to your work, how you give to the business. There's so much that it just seems like you're just pouring out. And I'm curious, this is a question I ask to all of my guests, is how do you take care of yourself, whether physically, mentally, spiritually? How do you sustain yourself so that you can continue to pour out to your patients and your community?
Well, I'll tell you, as a business owner and a provider, like my cup is pretty, I'm pouring out a lot. And so I do feel a calling. So spiritually, there are times when I'm more in tune with what God's trying to tell me and to my relationship with my creator. And there are times when I get distracted and I feel like I'm on my own, and I usually drop a ball or two or five. And then I'm like, oh crap, here we go. So there is dedicated time, for spiritual, filling that cup. Mental wise, I don't love working out. I do pay a trainer so that I'll go. I have a group that holds me accountable, and I'm really glad that I go. It's a big part. I feel better mentally and ultimately physically when I go. But if I know me, and if I didn't pay someone to make me go, the tyranny of the urgent would win, and I would sit here at the computer and do some more charting or something. So exercise, I like playing. I like playing sports. I'm a sport guy, so I still do a little indoor soccer. I'm just waiting for the next knee to blow or whatever, but it's still fun. I like, my mom is in her early 70s, and she's still a baller on the tennis court. And so we'll go hit once a week, hopefully, on the tennis court over lunch. And she can still beat me because she's better than me. So I get out, and so physical exertion in nature, as well as just putting my body through the ringer. And then I have a practice that fills me up as I pour out. Like that is, I admit, kind of a unicorn.
Wow.
When I was an ER doctor, I only poured out for the most part. You'd have occasional patient interaction that really touched you, but for the most part, it was just moving the meat. But this practice really fills me up as I sit with the patient. The problem is, after you're done with the patient, you've got the chart and you got the results and you got this and you got that. And then I really enjoy running this business. Yeah. But there's only so many hours in the day.
Yes.
And I have 25 employees, and that's hard because people are people, and I love them and they're amazing, but it's just hard. Yeah. So I think that's the answer for me is I have a posture of gratitude. This was never my idea. Even when we started it, it wasn't my idea. And of course the idea was just get 300 to 500 patients and make money and be okay. And that was the goal. And here we are. God has bigger plans. And so we have a posture of gratitude. We're loving what we're doing. And we've been given a vision that's exciting. It's for others to be able to join us and do this with us in a town near them. And hopefully, along with not losing sight of who's in charge on the spiritual health side, that'll just keep us going.
One thing that it kind of keeps ringing out to me is that this is a calling for you. You don't have to do this. This is something that you wanted to do. This is something that was, of course, incredibly challenging, but you've put in the work, the time, the investment, the energy to get the education, to get the resources. And now, like you said, what you pour into now is kind of giving back to you, because you can see the outcome data. You can see how it's impacting your patients. You can see how it sounds like there's so much more quality of what you're doing for your patients that sounds like it's very meaningful. And I just appreciate our time, Dr. Carter, in terms of just providing us with an insight to what you do and how you're integrating all of those components of physical, mental, emotional, and spiritual health. I think it's hopefully, I'm looking from afar, and I'm inspired, honestly, in terms of the work that you all are doing. So I really appreciate the time, and thank you so much.
Well, thanks for those words. And if there's anything I can do, if you're a provider out there and you're like, how do I start thinking about that? Reach out to me. I have social media, but other people are checking that. That's not my game. That's not my bag. So best way would be just email me at drcarter@mymdselect.com. And, obviously we're at mymdselecttyler.com is be the direct, access to my website, and just reach out to us, call the office, call me, and see how I can help you. Patient wise, just know that, there are other people besides me doing this. There are people that can do it virtually if there's no one near you. And if you don't do a membership based practice, that's fine. Just don't settle for 10 minutes with someone who just doesn't have time to hear you. They have their place, if you have insurance and they have their place, and someone's got to prescribe your blood pressure medicine, but there's other folks out there like Phil, like that want to meet you where you're at and help you with something along the mental, emotional, spiritual side of your health that will all interplay with your physical health as well. So hang in there, guys. Let us know if I can help you in any way. Philip obviously is a great resource, and I'm glad that you guys are listening to him. He's awesome. And so thanks, man, for what you're doing. And thanks for having me on.
Of course. Thank you so much, Dr. Carter. We'll definitely make sure to put all those links down below. It's something, like you said, they don't teach us in grad school. They don't teach us in med school or in mental, like they don't teach this stuff. And so when you can have someone who's already kind of pioneered the game, I think getting those resources and getting those mentors is absolutely the way to go. So thank you once again.
Thanks, man. It's been great. Appreciate it.